In our health alert tonight, flu season has arrived earlier than expected, and the CDC is reporting widespread activity in 6 states. So is Michigan one of them?
So that question will be answered by our chief health editor, Dr. Nandi, who joins us now. And Doc, which states are getting hit the hardest with this flu activity?
So Glenn and Alan, the influenza virus is certainly unusually high in some states for this time of year. When you compare last year's data, for example, to this year, there were no states reporting widespread activity. But unfortunately, the flu is off to a vigorous start in Alabama, California, Louisiana, Massachusetts, Nevada, and South Carolina. Luckily, Michigan was not on that list.
So how are we doing in Michigan with flu activity so far?
So, Leonard, right now, the flu code for Michigan is set at a minimal and local activity, but there's been an increase in lab-confirmed cases in the flu in southeast region. In fact, in Michigan, the disease surveillance system that tracks influenza shows that the number of cases has more than doubled in 1 week. So that indicates that things are ramping up here.
You know, Doc, you say the word flu activity and a lot of people start to panic. Will the flu season be worse than usual?
That's a good question, Alan. The flu season is notoriously unpredictable, so it's very hard to say. Yes, so far it's not off to a good start. And when you look at what happened to Australia, and there the winters take place sooner than ours, so they had an early and severe flu season. Having said that, we can't say with certainty that the same will happen here. But what I can tell you is that the flu activity has been above the national baseline, and so far 4 children have actually died from flu-like illnesses. So I highly recommend that everyone 6 months or older get their flu shot, especially young children and the elderly who are particularly vulnerable to flu-related complications like dehydration and pneumonia. Also, please don't forget to be vigilant about doing that, washing your hands, coughing into your elbow, and staying home when you're sick instead of trying to be a hero. These steps will really help everyone to decrease the risk of getting and spreading the flu. Really important. And we'll keep an eye on the statistics, let you know if things are ramping up here even more.
Hard to stay home, but you really should.
Absolutely.
Dr. Nandi, thank you so much. If you have a question or health concern for the good doctor, you can email him at Dr. Nandi at askdrnandi.com or send it to us on Facebook or Twitter.